name is Professor Denise Lyons, and I am an assistant professor at Anne Arundel Community College. I'm here today to talk to you about first-time simulation experiences in nursing students. As coordinator of first semester, I'm well aware of the students' fears and anxieties that they experience when they go through simulation for the first time. But what often happens is students walk out of simulation feeling very frustrated, feeling set up for failure, and feel that the objectives were not very clear for them, and that they choose to not want to come back and have a good experience next time in the following semesters. So with that information, I went through and I read all of their evaluations that they complete at the end of the debriefing each semester, and found that the students really gave me some really good feedback as to how I can make them more comfortable with this first-time experience. Along with that, the simulation committee at Anne Arundel Community College decided to come up with a pre-briefing format that all faculty were to follow. The name of this form is called Lab Assumptions and Pre-Briefing Essentials. This is read at the pre-sim, usually takes about 40 to 45 minutes to go through this, and it really helps the students with their first-time experience. So I'd like to be able to go through this with you and explain a little bit of how this helps the student. We start out with introductions first. Introductions are about 3 minutes long. We introduce the faculty and tell them who the facilitators will be for this simulation. And then we have the students introduce themselves if they're not familiar with the people that are actually in the room. Next, we go over the logistics. And this takes about 2 minutes. Where the restrooms are located, where the water fountains are located, where the students are going to put their stuff before and after, and the length of the simulation and the debriefing. Next, we go through some assumptions. This might take about 3 minutes, sometimes a little bit longer, depending on if students have any questions. And this is what we say to them. As we enter into the learning experience, there are a few assumptions that I would like to share with you. Learners are intelligent people and come into this activity with varied experiences and expectations. I explained to the students that this is very common to have everybody come in with something different in their lives. We have some students that have medical experience, while we have other students that come in with communication or community experience, and everybody comes in with a strength. Learning is a continuum. Everybody learns something during a simulation event, the facilitators as well. Learners want to have the opportunity to practice in a safe environment, which I'll explain to the students in a moment. And learners have completed the pre-assigned work and are aware of the objectives for this session. Next, we go through some general information to review, which takes about another 3 minutes. The simulation lab environment is a safe place for you to practice at the top of your ability and to be able to take risks. So students are aware that they can practice, make mistakes, and know that this is something that can still be safe and not cause any harm to any patients. We require that you keep the events and the performance of your peers in the simulation experience confidential. Sharing information outside the simulation diminishes the learning experience for your peers. In addition, it changes the safety of the learning environment. I often say that students should not go ahead and say what happened in simulation. That just like Vegas, what happens in simulation stays in simulation, just like what happens in Vegas stays in Vegas. Students also should not carry on and tell other semesters or other groups that have not gone through the simulation what to expect. Each student is given a role, and with that role, they have a different experience when it comes to going through and doing the simulation for the very first time. Expect to make mistakes today and learn from them. Again, we all learn something new from simulation. You will be assigned a role before the simulation starts. You will receive orientation to the simulation equipment and the simulation suite. Lastly, you will have an opportunity to participate in a debriefing of the simulation activity in an open and respectful manner. During the debriefing, you will have the time to reflect and identify on what went well, as well as opportunities to enhance advancement. Debriefing also gives us an opportunity to understand the rationale for our actions. Lastly, we talk about acknowledgments that I want to discuss with them, which also takes about another 3 minutes. The experience is different for everybody. We each have personal reactions when participating in simulation and debriefing activities. I explain to them that often students come in with different experiences in life. If somebody's had a miscarriage, they might have trouble with the OB simulation. If they have mental health with themselves or a family member, that might also trigger some concerns with them. So it's normal to have these reactions, and the faculty is aware and are able to pull the student aside and have a conversation with them after it's over. The mannequins are plastic, and the patient and family members are actors. We ask that you temporarily suspend reality, engage in the scenario as fully as possible so that you can gain the greatest value from the simulation. This is very, very important. We tell the students, you do not pretend. This is not all about pretending. It's about actually going into the real clinical environment and being able to take care of the patient. Next, peer reviews can feel very uncomfortable. However, being open to peer reviews supports you in your journey to achieve excellence in your practice. After all that is gone over, then we go ahead and we talk to the students about what the expectations are for each of the simulations. Sometimes there might be one patient in the simulation, other times there might be two. If you have a mannequin, you would explain to the patients and students exactly what you were going to have done. So the students would be expected to bathe the mannequin, change the bed, and possibly do a med pass. With the standardized patients, which is the live patient, you would explain to the student that they would be able to know that they would have to do a head to toe, a med pass, any wound changes, or any other needs that the patient has, possibly maybe some social work. The students are very aware of what they need to do, and all of this is very transparent to them. This was an idea that one of the students from prior semesters came to me with, and I felt that this was very important to let the students know exactly what to expect during the simulation. Next, we talk about the roles. So prior to the students coming into the simulation, they are given a sheet that lists all the different types of roles that they're going to actually possibly have to be involved with. There's a primary nurse, a secondary nurse, a medication nurse, a documentation nurse, and possibly maybe a resource nurse, depending on how many students you have in the simulation. So when the students get to the pre-sim, that's where I go ahead and I assign students to these different types of roles. I'm well aware of my students' strengths and weaknesses, and I give students opportunities to excel or possibly ones that need to be put out there a little bit more to see what they can actually do. And I go ahead and I give them roles assigned to what their strengths and weaknesses are. After that, we then go ahead and review the objectives and all the prep work that needed to be done. Again, very transparent in what will need to be completed with the simulation. The students are aware of the medical diagnoses, the medications, we talk about nursing diagnoses, and this will help the student become a little bit more comfortable prior to going into the simulation. After that, we take the students up to the simulation suite and we give them an orientation to the mannequins and the equipment. This should take maybe about another 5 minutes to complete. When we're there, we let them touch the mannequins. We tell them what's working on the mannequins and what's not. Oftentimes there might be an IV or a tube that's hanging out of the mannequin that is not related to the simulation, and we're very clear with the students that they just ignore that. We tell them where the voices of the mannequin will come out, and tell them what side it might be a little bit better to speak on so the faculty can hear them. We let them touch the mannequins to find the pulses. We also show them where the supply cart is and the medication cart is. We can also show them where the computers are going to be. If you are using an electric medical chart, please make sure that the students have this information pulled up ahead of time so that they can go ahead and be ready to begin the simulation instead of trying to figure out what their password is. And so the students are given a little bit of time before the simulation begins to kind of pull together as a group, decide on what they're going to do to be able to look around the room. After that part happens, we have the students step back out into the hallway. We bring in the standardized patient, we get them all ready in the bed, and then we tell the students that once they go into the room, simulation will begin. So with this, we found that after we made these changes, and using this pre-briefing guide for students, they had a much better appreciation of the simulation experience. While faculty can't totally decrease the students' anxiety, using these suggestions help the students realize the importance of simulation plays in providing safe care to patients. Thank you.